So genomic testing, we know, is really important for our patients with advanced non-small cell lung cancer. And over the last year or so, NHS has crystallized this further into 7 large genomic laboratory hubs for England. There are equivalent solutions for Northern Ireland, Wales, and Scotland. At least in England, there is now a cancer test directory where at least 8 different genes ought to be analysed, both for by DNA and I would argue as well by RNA for fusion products as well. This leads the UK to be in a relatively enviable position of having core-funded genotyping for all the FDA-approved targets that we have. And now, the challenge has been that many GLHs, whilst they've been set up, they haven't been able to deliver this panel effectively. That is gradually changing, and many GLH laboratories are coming online and being able to deliver NGS. And that's really important because when you have patients, whether smokers, current smokers, ex-smokers, or never smokers, we are increasingly getting targeted therapies across the genetic spectrum. So targeted therapies for the ALK-ROS and EGFR that we know, but also for BRAF, for KRAS G12C is now implemented, and MET14 skipping mutations, which are often seen in a older ex-smoking demographic than we've seen before. So this infrastructure is there, but most importantly, the drugs are available as well. And it's really hard to keep track of what drugs are available because this is not just through NICE, it could be through CDF, it could be through pre-licensed schemes, it could be through a Orbis approved pathway. There are, or it could be through named patient schemes as well. But all of these drugs are available, and it's really important that we make sure that our patients do get appropriately genotyped and access to the right medication. That includes RNA testing as well, because RNA testing is the best way of picking up splice site variants, such as MET14 variants, or fusion variants, such as NTRK variants, ALK-ROS, and these are poorly detected by I8C. So the take-home message is it's important that we do genotyping appropriately.